All right, you may be seeing headlines right now about Candida auris, a fungus that some are calling a superbug. Health officials reporting hundreds of cases now here in Texas. So the question is, how concerned should we be about this? And to help answer that question, we are joined, thankfully, by medical expert Dr. David Winter with Baylor Scott and White Health. Dr. Winter, thanks so much for being here with us today.
Yeah, good to be with you, Jason.
So let's start off with this. How is this fungus spread, and how does someone avoid coming into contact with it?
So you said the name Candida auris, and auris is a medical term for the ear, and that's exactly where it usually hangs out. I've got a model here. Here's your ear, and here's the ear canal. There you go. That's where it usually hangs out. If it hangs out there, or for that matter, anywhere else on your body, it's usually benign, doesn't do anything. Maybe a little bit of a rash, usually not even that. But if it gets inside the body, that's when it causes a major outbreak, a septic-like disease.
All right, so why are we seeing so many cases right now, do you think?
Well, first we should say that this usually doesn't affect healthy people. This affects people that are old, frail, maybe have some immune deficiency. And we're seeing lots of that in hospitals, when people in the hospital for a long period of time, in nursing homes, people who stay in any kind of long-term care facility. That's where it can get inside the skin and cause a problem. And those are the folks who are coming down with this. The healthy folks don't usually have any symptoms at all.
All right, so let's talk about symptoms here because we should know what to look for here. What are some symptoms that could indicate that somebody might be suffering from this specific fungus?
Yeah, it's like you would have with any kind of bacterial infection in your body. Fever, body aches, you may not have a lot of strength, a lot of weakness there, short of breath maybe. It sounds like you have some kind of major illness, but the important thing to know is that bacterial antibiotics don't work for this. So you need to get a diagnosis. If you have some kind of bacterial infection, or if you think you do, make sure you get a diagnosis, because the regular antibiotics do not work for Candida auris.
So people hear that, and boy, that starts sparking fear, and you hear this word superbug, and you think, what are my options if I really get sick with this? What kind of treatment options are there if somebody gets infected with this, doctor?
Yeah, there are good treatments. The bacterial antibiotics don't work. Most of the fungal antibiotics don't work, but there's some new ones that are out right now, and doctors know about this. You can get those right antibiotics in you, the fungal antibiotics that are new, and those do work to get rid of it. So there's a good treatment for it, but you got to diagnose it. And it's not something that we'll usually think about for healthy people in particular, but the old, frail people, people that have been bedbound for some period of time, they have some other illness going on, that's when we need to think about Candida auris, this fungal infection in the ear perhaps, or anywhere else on the body.
Okay, so if we advocate for somebody in our lives who's in one of those situations that you just mentioned there, it's one more thing to sort of keep up with. Good to know, though, that there are effective treatments out there for this. Dr. Winter, thank you as always for bringing some really good advice to these things that tend to scare people when they see the headlines.
Great, thanks you, Jason. Good to be with you.